Hello, 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 and welcome to BDO's third annual Men's Health Summit. I cannot believe it has been 3 years of us putting on this Men's Health Summit. I am excited because one, it's June, and two, we're talking about men's health. And so that's very important. When we're talking about the health of a community, we cannot, there's two genders, and so we have to talk about both. So last month we did a Women's Health Summit, and today we're doing our Men's Health Summit. And this is the first program of the Men's Health Summit. So I'm so excited. We're talking about a body part that is specific to men only, and that is prostate health. And so, as a man of color, as a black man in this country, I am keenly aware of the disproportionate impact that prostate cancer has on our community. And so we have a wonderful expert, Dr. Posadas. You've seen him before. He's been on BDO before. He's coming here to give you all the information that you can use. And if you're not a man, please let somebody, a man in your know, whether it's your uncle, your brother, your husband, your father, let them know this information is out there. Share this on your page. Tag a friend and say, hey, they're doing good stuff and talking about prostate cancer over on BDO. You might want to get this information. So with that being said, before we get to our guests, a couple of things I need for you to do for me. Number one, let us know where you're watching from. Drop that in the comment section. We'd like to know cities and states and everybody, countries, wherever you're watching us from, drop that in the comment section for us. Number two, as I said previously, tag a friend or share this on your page. Get this information out to as many people as possible. To all of the men that need this information, tag them, put it on your page. Let them know that we're talking about this. And then number three, if you have any questions throughout this broadcast today, please, please, please drop that in the comment section and we'll try to get to as many of your questions as possible at the end of the program. Okay? With that being said, let's bring on our guest. Our guest is, like I said, he's been on before. His name is Dr. Edwin Posadas. He is a hematologist, oncologist at our friends, our partners over at Cedars-Sinai. Good afternoon, Dr. Posadas. How are you?
Hi, Alice. Thank you so much for having me on. It's an honor to be part of this important summit. I'm a huge fan of the work that you all have done, especially for the African American male community, and particularly air cancer, because this is a disease that I absolutely positively despise. It hurts many, many good men. It affects their families, as you mentioned. So even if you're not a person who's got a prostate in your body, you probably care or love someone a
Yes.
whole lot who does. And so this information can be very valuable. And given the fact that black men are disproportionately affected by this disease, and I really hate to say this, but in the studies that we've been doing in prostate cancer, we're not seeing the representation that we need from men of color to understand how not only the disease but the treatments that we have available, how they work, how they affect both positively and negatively. Men coming from different communities, different genetic backgrounds, that can make a huge difference in how we care for things. So thank you again for having me.
Oh, no problem. We're going to give people some good news. And because the good news is prostate cancer is one of the more treatable cancers out there, but we've got to catch it early. And there's a way to catch it early if you have it. So we're going to be talking about that today. So first things first, Dr. Posadas, I'm going to go all the way back to the basics. We're going to get down to the basics. What is the prostate and what is its function in the male body?
That's a great place to start, Alice. So um, people unfortunately will often refer to it as the prostrate gland. It's kind of not quite that, but it's kind of close in some senses. There is there's a word kind of relationship, a history. It goes back to that. But the prostate gland is one of the male sex accessory glands. So it's an organ that sits below the bladder, right in front of the colon, kind of at the very bottom of the male pelvis. It participates in producing some of the necessary enzymes and a little bit of the fluid that goes into the male ejaculate. So it's part of our whole reproductive process as men. The good news, in a sense, is it's not a vital organ. Removing it or having something done to it, for example, to relieve obstructions, will not alter your not necessarily alter your ability to live a happy and full life. But if it does get diseased, getting some attention to it early is really a key because its anatomic location also puts it in a place where you may not really realize there's a problem without actually being proactive about getting that sorted out before something else happens to you. And there is an opportunity, as you've already alluded to.
Absolutely. So I think what's interesting about that is one, it's what is functionality. It is important, but not vital. And I think that's two separate issues that we have to kind of talk about. Yes, it's important. It does have a function, but is it vital? And so it's not vital to your overall health. And so we do have to recognize that. The other thing I think that you're alluding to is, okay, how are we going to be proactive? Because we're not going to feel, it's not like a cold where you feel symptoms if there's something going on with the prostate. So when do men in general tend to show signs of maybe some issues with their prostate?
Mhm.
And is that different for men of color, particularly Black men?
So this is a really, really great question, and we want to be a little sensitive to this because I love the way you framed it, Ellis. The prostate gland sits around, and to go a little further into its anatomy, it sits around the tube that connects the bladder to the penis and then goes out into the outside world. So it's kind of in a little bit of a delicate location.
Right.
Often people think that when we talk about doing something to the prostate gland, it means chopping off the penis. It doesn't. I want to be real clear about that, folks, because again, I really want to stress the fact that if these things are caught early, a man's full health, urinary, sexual, and otherwise, can be preserved. That's really important. But the prostate gland, because it sits around that tube that connects the bladder and the outside world, you can get some symptoms of prostate trouble, not even necessarily cancer. So unfortunately, about 1 out of every 2 men in his lifetime will have some kind of prostate related complaint because, well, as we age, we're men. Our organs, just like your bones and your joints, kind of get sore and stiff. The prostate gland kind of gets bigger as we age, and as that gets bigger, that can make a little constriction around that little tube, and you can get what we call lower urinary tract symptoms. The bladder may not empty as well. It may take a little. The stream may not be as strong as it was when you were 16, and you felt like you could empty your bladder out in 3 seconds or less. Doesn't mean that you're broken, but those could be little signs that something is happening with your prostate gland that might merit a discussion. Those things that are addressable, again, without too much trouble. But when it comes to prostate cancer, believe it or not, you may not even have those kinds of symptoms. So again, having a physician with whom you have a relationship, with whom you can talk about these things and trust, who will listen to you, understand who you are, where you're coming from, becomes incredibly important in terms of being able to interpret some of these changes that can happen and associated with the prostate gland. And they can let you know what, maybe we need to think about screening you for cancer in association dealing with your discomfort.
Well, let's talk about those screenings. So we hear it particularly in Prostate Cancer Awareness Month, which is in September every year, and we see it from time to time, these public service announcements, which ironically also is known as a PSA. So when we're talking about that PSA
Yes.
exam,
Yes.
screening, what is that, and when should men start getting regular PSA screenings?
Real good and important question. So I'm going to start off by saying that prostate cancer screening, I believe, is something that can save lives. Because I really hate this disease, and I've seen a lot of good men go down from it, and I'm really awfully sick of it. But there is some controversy in the medical field about prostate cancer screening. For individuals that are at kind of baseline risk, there's a little bit of a question about whether it's necessary at all. I think at the very least, it's a discussion a man should have with his physician, because it's kind of hard sometimes to make that decision in isolation. So again, this is why I think that partnership between doctor and patient becomes really key to establishing good health. not just for prostate, I mean, really for a lot of other health issues that are out there that can affect men of color, particularly things like hypertension
Yep.
and heart disease. So, I kind of lump this all together as being proactive about your health. But I will say that, men of color, men of particular African descent, are in increased risk for developing prostate cancer than age-matched Caucasian counterparts. And this is well recognized in the prostate cancer community. It pains me to know that this information isn't as out there as it needs to be in the Black community, because we should not approach Black men quite the same way because of that increased risk. I would say most men should at least have a discussion about this by the age of 50. If there's a family history of prostate cancer, now, and this is a touchy subject because depending upon your family, your cultural background, a lot of folks, particularly male folks, don't really like to talk about cancer at the dinner table. It's not one of those, hey, did you have your prostate checked today type discussions, or someone say, well, grandpa had prostate trouble, but we really didn't know what it was. And these are things that can kill you, right? So, you know, it, being open, finding kind of a community, or creating a community amongst men where there's a safe space to not only safe to talk about these things, but to encourage one another to be proactive about health. I think it's actually a part of being a true man and leader in your community, because a man has to be able to advocate for himself, to protect and to serve those that he has pledged himself to, whether it's your family, your church, your neighborhood, your business, the people that you work with. You have folks relying upon you,
Right.
and keeping yourself healthy is a real important part of that. Knowing where you came from, and what happened to your predecessors, can say, your family history is riddled with prostate cancer. Your dad, your uncles all developed prostate cancer before the age of 50. We start to scoot that screening age backwards. And so again, this dialogue between a man and his primary care physician can be really vital to making a right decision about when to start screening, because some men do need to be screened as early as 40. I would tell the young Black men out there, in your 20s is probably a little too early to get checked. But at the same time, if you know that in your family it comes early, please don't be behind the eight ball, because we have such good treatments that are available. We can really reverse the risks that may be coming your way if we catch it too late.
Mm. Wow. So I will say, I'll make it personal. I do have a family history. My father had prostate cancer, and had his prostate removed, as well as my grandfather also had it. So I have a double family history. So I started getting screenings at 35. Now, everybody doesn't have to do that, but I did because I knew, and we had those conversations. And so
Yes.
what you're talking about is exactly right. So, men, when you're at the basketball court with your buddies, at the bar, in the cigar bar, playing golf, barbershop, wherever you are, where men gather amongst themselves, men's church group, that should be part of those conversations. Your health in general should be part of those conversations, because I know we're going to talk about this as part of this program. And yes, there could be some sexual, functioning issues as a result of treatment. However, there's also sexual functioning issues when you have hypertension. So
That's right.
there's other things that going to impact your sexual functioning. So when we're talking about your health, let's talk about all of your total health, and not just specific parts of it that you're comfortable talking about. Yes, it's in an uncomfortable area. Yes, and some of the PSA exam is just a simple blood test, right? And so they draw blood and they test it, and they test for that PSA, which is a prostate specific antigen, which is what I put on the screen there. That's what PSA stands for, and that's what they're testing for. The number that you need to know in your head is 4, right? That is the number that you need to have in your head is 4. As long as you're below 4, technically you should be fine. Now, there are cases, and Doc, you back me up on this if I'm wrong, But there are some cases where you could be below 4, but there'll be a red flag, because if the year before, yes, so like you were at 0.7 and now
Right.
you're at 2.3 the next year, that is a significant jump. So if there's a significant jump in your PSA amount, even though you're under 4, that may send up some red flags and kick in secondary kind of exams to make sure that you're not on the verge of developing prostate cancer. Am I close? And how close am I, Doc?
I think that's a pretty good rule of thumb. I would tell you, and I would encourage you to ask your doctors that, are there particular um, specific cutoffs for me based upon my age and based upon my race.
Okay.
Younger men should, in general, have a very low PSA, and so I would tell you that a PSA of, let's say, 4.5 is very different in a 40-year-old than it would be in a 70-year-old.
Gotcha.
And believe it or not, it's different in a 50-year-old who's white and a 50-year-old who's black. And so
Okay.
you want to be kind of sensitive to those things. I'm going to tell you, a lot of folks are not. That these guidelines came out for the American Urologic Association. So some primary care docs don't kind of know that reflexively. But I tell you what, Dr. Google, about 30 seconds in there and a couple keystrokes, you'll find age and race race normalized PSA values. And I think Alice said it real nicely. You said it real nicely, Alice. It's a simple blood test.
Yes.
It's really no sweat off your back. You got to get your cholesterol checked.
Mm-hmm.
You got to have your kidney function, other things checked as part of a routine physical that can be added on without any real additional effort. And sometimes on top of that, and I recommend this to men and their doctors. And I got to admit, I think it's more on the doctor side than on the men's side. But there's simple low-cost tests. It's called a digital rectal examination.
Yes.
Gloved finger up the backside. You only have to do it like either once a year, once every couple of years to get this done. But it's a quick and low-cost way of figuring out if there are any nodules there that need some attention. So you don't have to call ahead and schedule and have a big copay for all that. That's a little between you and your doc. Done right, takes less than a few seconds.
So we had an interesting question from one of the viewers. He's saying he had a high PSA number. With his doctor's approval, he implemented a diet and exercise program. The number dropped precipitously. Should I go beyond screening since I lowered my PSA number this way?
Well, that's a pretty good question, and I'll throw a couple quick comments in here about that. So, folks always like to ask me about the importance of diet and exercise, and I'm going to tell you, taking good care of yourself begins with good diet and exercise, as well as proactive health maintenance, keeping your blood pressure under control, seeing your dentist, so on and so forth. And so if your doctor made some recommendations to you that you were able to follow and get that kind of health benefit, A, I think you got a good doc. And B, I salute you for being able to implement those things. Because sometimes telling somebody to put down that bag of potato chips, is not so easy. But we all know it's the right thing to do. I know I don't have to preach that too hard. Just a little gentle reminder. If your PSA responds to all that, that's probably good, because it probably drops some inflammation that's involved. Do you need to go beyond what we call PSA blood testing or PSA screening and a digital rectal examination? I probably wouldn't tell you on that. I'll just go to getting kind of a random biopsy done. But I think Ella said it very nicely earlier, where looking at trends in your PSA become important. Let's say you put all that diet into place, your PSA drops. Now you keep on that diet. You're good. You're keeping your weight down. Things are working well, and you start to see your PSA start to tick up, especially if it starts to tick up quickly. I'd say that's a point of discussion for your doc, because let's say your PSA hasn't gotten to 4. Let's say it jumped from 1 to 2.5 in a year, no symptoms of prostatitis. I'd say, you know what, you might want to get that checked out a little further. And that could be an MRI before you get to a biopsy, because I think those are particularly helpful. It's something you got to work out with your insurance company. But those trends, as Alice said, really important. That's relationship again.
Yeah. And just for those that are watching, we're here with Dr. Edwin Posadas from our friends over at Cedars-Sinai. We're talking about, this is the first show of our 3rd annual Men's Health Summit, and we're talking about intimacy and prostate health. And just as a quick, science English combo, itis is an inflammation. So when you hear prostatitis, when you hear hepatitis, anything like that, that suffix means inflammation. So those of you that may or may not know that, I know I sat in the back of the classroom, not really paying attention in science. So I had to learn this as an adult. So yes, that means inflammation. And so anytime, and so there are some other non-prostate cancer related things that could be happening to the prostate, like inflammation. I hear the commercials about there's other conditions associated with inflammation of the prostate, and just by general aging, your prostate is going to get a lot larger as you age. As we age, I'm not immune to aging. So as we age, that prostate is going to get a little bit larger. And so that's why you need to have a relationship, as Dr. Posadas has been saying the entire show, and I am echoing that. I'm standing on that drum with him, banging on it. You have to have a relationship with a primary care provider that knows and has tracked your history over time. Can't use urgent care, can't use an emergency room as your health care. You have to have an established relationship, however that is, so somebody can really follow you and you develop that relationship where you could have some candid conversations about that. So, all right, so the patient's question, the viewer's question brought in another thing that I've heard. So we're gonna dispel a couple of myths, and one of the things is, okay, but get the digital rectal exam. It's inconclusive. Can you request an MRI before we go all the way to biopsy?
So I think that's a good and insightful question. So I personally really like MRIs before going to a biopsy. There was a study published in one of the big medical journals, the New England Journal of Medicine, that showed that use of an MRI could help a urologist, that's the doc who does the biopsy, to target some particular areas that may be more suspicious to increase the yield of having a biopsy done. Or the other thing it might do is perhaps give a patient some assurance that that change in PSA is not concerning. Okay, the radiologist will look at that MRI and say, you know what, based on the imaging characteristics, I see something that's suspicious. Or you might get a report back that says that, you know what, you might want to hold off before doing something. That gives you a little room to say, you know what, before we go stick some needles in, let's, as we heard earlier, do some dietary alterations, some lifestyle changes, maybe even if there's a problem, an infection, course of antibiotics, check that PSA again before having to put yourself through something. But again, underscoring the importance of having that relationship where you can do these things with follow-up instead of acting reflexively on these things. So yes, I think that's a very valuable tool you can have. I have to admit, some insurance companies can be a little bit tough about all that, but you know what? Your docs have the capacity to take some literature back and do a little bit of pushing on those guidelines, especially in a situation where your health is at risk. And I would encourage you to do that. If you have a good ally in a physician who's guiding you through all this, and they can go through those steps with you, it can make a difference.
And just just on a general sense, I think insurance is more apt to lean in towards preventative services versus intervention. They'd rather know now if they're going to have to pay for a surgery or help you pay for a surgery versus something more dramatic
100%.
later on. So yeah, so that is an option, because I do hear from the men that I've talked to over the years and some of the groups that I've participated in, that is kind of one of the pushbacks. Oh, biopsy, right? Because it's uncomfortable. They have to take a clip of a piece of the prostate and then go get it examined to see if it's cancerous. And so that is, from my understanding, and this is just a non-scientific survey, that a lot of men drop off in that space. They get the high PSA, they've gone to get the PSA, they get the number back, and then they don't want to go back and follow the next steps, which could be a biopsy. So an MRI is uncomfortable. It's that tube and it's loud, but that could be something that's less invasive, but you can get more data to help drive your decision with you and your provider before the biopsy. So ladies, if you're watching this for your man and you're taking notes, tell him he can go get an MRI or ask for an MRI to have that discussion before the biopsy. So that is an option.
Mm-hmm.
One of the things that I also heard, Doc, and I'm going to ask you this question, is there are times where we could inflate our PSA without knowing. And one of the things that I heard was sexual intercourse
Yes,
temporarily increases the PSA.
that's correct.
Okay.
That's correct. Actually, it's not even just sex. And listen, that's not harmful. Okay, let's be real clear. That is one of the blessings the good Lord put on this earth for us. All right. But I will tell you, anything that causes mechanical irritation or movement on the prostate can do that. So I think a fantastic form of exercise is cycling, and I've met a lot of men that really enjoy that. Great. It's great for your cardiovascular health. Great way to kind of get around to, rather than hop into a car, contributing to our traffic problems here, at least in the greater Los Angeles area. As long as you're being safe about it, it's wonderful. But that bicycle seat, bumps right up against the prostate gland, against the floor of the pelvis, and that can do it too. I would tell you, if you're that kind of guy, I would make it clear to your doc, oh, by the way, I've been, the other, my partner and I, we were together, and we had some relations a couple days ago. Will that affect my test? He may say, you know what, let's hold off a few days, and then get that blood test so that it's a little more accurate. Or if you get that PSA back and then you remembered, oh gosh, I was out. I did a 10-mile, 20-mile ride with my friends the other day. You might want to let your doc know so before he goes and orders that MRI or sends you over to the urologist, you take a breath and say, you know what, let's wait a week, stay off the bike, come and get that checked again. But it is important to know that there are non-cancer reasons that are perfectly healthy, that can make that number go up. So don't go jumping off the ledge just because your PSA is elevated.
And don't have relations the night before you have your PSA exam. So just
Yes, sir.
FYI, I rode my bike today. I did 4.25 miles. So that could artificially inflate my PSA if I wanted to go have a test done. So those are things. So while you're taking these notes, those are things, couple of things that you need to be aware of and be cognizant of when you get that PSA. So, and that's, again, we're going to keep repeating why it's important to have a relationship with your primary care provider, because with a primary care provider, because y'all can have that discussion. Whereas if you're going into an urgent care just to get a physical for work done, they may see that and now start ringing alarms, and it could be something as simple as my wife, my girlfriend, and I had relations last night, or I was with my cycling group, and that's why my PSA is elevated. Mm-hmm. So really, the more you know. So we had a good comment. This is not a question, but a good comment. I just want to give Maurice some encouragement here. He is 7 days post-op. He had his prostate removed due to stage 1 prostate cancer, and so one, prayers for your recovery, Maurice. Please keep us updated on your progress. There are some great groups. I don't know where you're located, so if you can let us know where you're located, we can connect you. There's some groups on Facebook, and I know there's groups in LA, and I live in Atlanta, and so there's some wonderful men's groups that talk about that have prostate cancer. And so it's best to find a community that understands the challenges now that you're post-op, and that can relate to it versus you feeling isolated in that space. So Maurice, if you're still watching, just let us know, and we can get you connected to FIN, Prostate Health Education Network. It's a great site and group to connect to as well, and they've got a lot of videos about prostate health there. So those are just a few off the top of my head but again, prayers for your recovery. All right, so we're talking about treatments. There has been some wonderful advancements in cancer treatment that I've seen, just really targeted treatment specifically for that person, biomarker testing, all of these wonderful things. What's the latest in treatment for prostate cancer, and what are the different types of treatment? And I know it's not just removal. I know Maurice had his removed, but
Mhm.
removal is one of the treatments, but there are other treatments as well. So, Doc, kind of let us know what are the treatments for prostate cancer.
Sure. I just want to echo those prayers for Maurice. I'm glad if it needed to be done, my friend. I'm glad you found the time and the focus to get it done. Be patient with yourself because recovering from surgery um, is a bit of a journey. But there's an upside to all of it, and the body will heal, and you'll get back to normal. So, but give yourself time. Don't make judgments on just on day 7. I'm sure every day for you is getting a little bit closer to whole. Surgery has remained an important standard in the field. It's one that we've done for a number of years, and we know that it can save the life of a man who has an aggressive but localized prostate cancer. I add a couple things onto this note because you know um, I don't have all the gray hairs in the world, but my wife likes to point out that they're not as dark as they used to be, and that's okay. I mean, we earn our silver as we move forward, gentlemen, or the loss thereof, the hair.
Yes.
But it's all okay. I mean, it's part of what we do as we get older and wiser. Um, the procedures now that are done, even surgically, they're making smaller and smaller incisions, and even using robots to assist the surgical procedure, and that has improved visualization of the surgical field so much that the side effects seem to be a bit better. My patients are coming back to me with a high degree of satisfaction from their surgical procedures. I'm not hearing the same issues I did 15, 20 years ago when we were doing more open prostatectomies about issues with the bladder trouble, or the time to get the erectile function back, catheters that had to be left in before after surgery. So I salute the urologists on how far they've come. There's a couple other caveats I want to put in there. Well, that's been a standard in the field. The other standard in the field has been radiation treatment, and there are some men that just don't that aren't appropriate for surgery. Let's say their heart or their lungs make the anesthesia risky, and you've had a heart attack a few months ago. Last thing you need to do is have the strain of anesthesia there to to put you at greater risk of complications during an operative procedure. But radiation can be a highly effective means of treating this. I think you need a good radiation oncologist if you're going to do that. And I'd say just like you need a good surgeon. Um, and I would say on both those fronts, listen, prostate cancer, it's an important disease, but it has a slower natural history than some other very aggressive cancers like pancreatic cancer, lung cancer. I would say take some time to figure out who you want on your team. Build your team to work with you and your family to ensure that you know what's going on there, that you have that trust in that human being that's going to help you through this process, because they'll be your guide as you go through the recovery. And there are varying levels of skill and experience out there. Ask them. Ask the doctors, how many cases have you done? How many men have you treated? What kind of outcomes do you see? What kind of equipment do you have access to help me get to where I need to be, which is disease free, and still living a good, whole, and meaningful life. But I do want to make the case that and I touched on this very very early on, that while some men actually need treatment for their prostate cancers because they're aggressive and they're potentially threatening, but there may be men that have less aggressive forms of cancer that may be able to defer treatment. But I'm going to tell you, knowledge is power. And for those men that have maybe a less aggressive looking cancer, one that's not moving quite as quickly, they can go out into a program, what we call active surveillance. That's where you partner up with your doc and you keep an eye on this together and say, you know what, that's a sleeping dog. I'm going to leave him by the fireplace, leave him alone. He's not barking at anyone. He's not making any trouble. But if things start to change, you catch that early, then you can make a choice and say, you know what, we're seeing trouble changing. It's coming down the line. Now we better start talking about when to make that decision. That's 1,000 times better than burying your head in the sand and saying, I don't even want to think about this. Because at that point, you will get caught behind the 8 ball. And you're going to be wishing that you found out earlier when something could have been done before you had a more aggressive cancer present. I would also make the point that if you have access to some of these research centers like we do here at Cedars, but just seeing folks like over in Texas and other places, there's a lot of great places around the country that are experimenting with some new means like focal treatment for prostate tumors, like high intensity focused ultrasound. We're seeing some real promise, and I tell you, as we get those treatments moving forward, it's important to find men of different backgrounds to come and try these things out, because as we've touched on, prostate cancer affects men of different genetic origins differently. And so we really need to, as a field, be able to talk to how Black men do with the various forms of treatment in terms of satisfaction, disease control outcomes, because they are amongst the highest risk folks that we deal with. That is not a secret. It's out there. It's out there in all the literature. It is underscored in importance by our government, by all the research organizations, and it's the patients that really help us to move that thing. Is that partnership. And that's why I wanted to be here today to talk to you all about the fact that we need you guys to step up and help us through all this to make those advancements together.
You laid out some wonderful options, and I think in speaking, I can't speak for all Black men, but I can speak for the ones that I've talked to. We've got to get past the stigma, right? We've got to get past the stigmas that are around our prostate health. We understand that sexual virility is essential to our ego as men, right? As a general male being, and so we don't want to do anything to disrupt that. But where would you rather be? Dead or in bed, right? And so that's where we've got to get beyond that situation. And as Dr. Posadas alluded to, the treatments are getting so much better that functionality has had. If it's impacted, that impact is less than it has been previously, because the surgeries have been so advanced and they've been performing so well that it returned. And again, what's more important to you? Is it your life or your sexuality? And so I think that's really what we have to get into, because catching it early puts you in a much better space of survival.
And I do want to make the point that finding out that this is happening doesn't mean that you've got to say goodbye to that intimate embrace. You catch this thing right, you do it properly. I have patients that continue to live a very happy, meaningful life with physical activity, sexual activity, good urinary health, and things they're alive to enjoy. I think Ellis put it real nicely. They're watching their children graduate. They're watching their grandkids come. These milestones in life. When you take a step back, you think, gosh, I would not have missed this for the world. I tell you, it warms my heart to know that men are making those goals in life, even when facing the dreaded disease of cancer. While it takes a lot of good lives, anytime that we can knock it back or eradicate it from a man who's just trying to live his life meaningfully and serve those people that he loves, I think that's a real victory, and we're getting better at it. In addition to all those different techniques, I just want to make a note that we talked about MRIs being a way of guiding biopsy. We even have ways of doing PET scans now to find regional spread earlier, so that if you have to have surgery or radiation, we can customize those plans, to really fit the at-risk sites for you, to make those treatments even more effective. My own specialty, I use a lot of medical therapies to help men with advanced prostate cancer, and that always sounds bad that it's come back. But I'll tell you, I was talking to one of my guys the other day. He told me, it's been 17 years since I was diagnosed with prostate cancer. I'm like, and how you doing? He's like, I got a lot of work to do still. He's got like his fourth or fifth grandkid coming. I think it's his first grandson that he was very, very excited about meeting. He's helping his kids to build a new home because they badly need one.
Right.
And he was telling me they weren't going to make it happen without him around. So he is a very functional member of his family, and they're leaning on him. They need him there, and because he's getting proper attention for his prostate cancer, he's living that life and he's doing it fully. So there is life beyond the cancer diagnosis. Don't run and hide from it. Take the bull by the horns, guys.
I love it. I love it. So, are there any myths surrounding prostate cancer that you want to dispel today, Doc?
Yeah, I want to make the point. One thing that it kind of gets my goat a whole lot is I will give a talk to folks about prostate cancer, and they'll tell me, "Oh, well, that's not an important disease. It's a cancer that old men get it, and they usually die from something else. It's not a big deal." And I just shake my head because it comes down to this: prostate cancer is the most common cancer, non skin cancer that affects men in the United States. About 1 out of every 8 men in the U.S. will be affected by prostate cancer. When I turn that scope and look at high risk groups like men of African descent, African American men, that becomes one of every 7. Um, and the age of diagnosis gets scooted up. And typical age of diagnosis is around 67. But guys, I'm gonna tell you, maybe if you're 20, 67 sounds old, but the older I get, the more I realize I'm still living a good life, and I don't feel like I've hit my peak yet. And I will tell you, I've met guys in their 60s. I'll say the same thing. They've got a lot of momentum going. They're nowhere near looking at the end. Median life expectancy of a man in the U.S. is well into the 80s.
Right.
So that is still a long runway to think about for health and quality. It is the second leading cause of cancer death in America. In fact, it kills almost as many men as breast cancer kills women. Now, it delights me to see that once a year some of the big cities they turn pink, because I
Right.
think breast cancer is a horrible disease. It affects a lot of women. It affects women of color in particular. Triple negative breast cancer is very common, much more common in African American women than it is in their Caucasian counterparts. But
Yes.
let me tell you, see, women, they'll get out there, they will march, they'll wear the pink, um, and they will form a sisterhood, and support one another through all this. Guys, we got to do the same thing for prostate cancer, especially amongst Black men,
Yeah.
because it cannot be the silent killer that's out there in the community. And when we start looking at areas where access to care becomes a little more concerning.
Yeah.
Yeah, I've practiced medicine in Baltimore, in Detroit,
Mhm.
Chicago, here in LA. I am well aware that there is variation from parts just across a city in how men access the healthcare system. We need to break that iniquity. There are a lot of good folks out there, who are in the know, trying to reach out to men of color to get screened for prostate cancer and other health conditions. I think work with those folks. Okay, I mean, staying ahead of these things is terribly important. And if you have access to good health care, don't make it something that's just kind of sitting there that your boss gave you on the side. Take advantage of it
Yeah.
and stay ahead of this, because these are important health conditions that are dealt with properly. Yeah. So that big myth of men are going to die, old men die with this, not of it. Don't listen to that. Okay. Be proactive.
Be proactive. That is the key. Oh yeah, well, you have just said a word right there. I think you're absolutely right. There are a when we're talking about health inequities, right? There's a bunch of factors that contribute to it. But what I say is control what you can control.
Hmm.
And part of the one of the factors of health inequity is really not engaging into the system. We
Yes.
have to, and yes, there is historical reasons for distrust of healthcare, but we cannot let that be the reason why you don't get care for yourself and your family, and get it all checked when you go, because we know the big two are high blood pressure and diabetes, right? Those two big two in our community, but high blood pressure alone and obesity alone, they contribute to almost over 200 illnesses could come as a result of being overweight, obese, and from blood pressure. And blood pressure is called a silent killer for a reason, because you're not going to feel symptoms until something happens. Heart attack, stroke, anything happens as a result of having high blood pressure. So please, and then when you're there, they're already checking your blood sugar. They're checking it. You're checking your A1C. They're checking your blood sugar. Just say, hey, doc, go ahead and drop that PSA on top of that, and let's have some real conversations. I've had the digital rectal exam. I'm going to speak from personal experience. It was uncomfortable, but it was about 10 seconds of being uncomfortable. And if I ask you a question right now, have you ever been uncomfortable for 10 seconds? If your answer is no, I would just say go outside in the South. It's 100 degrees. You'll be uncomfortable for 10 seconds. Okay. And so that's not the reason you should. And yes, it's not comfortable. It's not a fun. I was shocked, scared, didn't know what to do when he said, drop your pants and put your hands on the table. But I did it, because what's more important is knowing and my health than some made up thing in my head and the discomfort that I felt in the moment. So I'm going to dispel that myth. Is it uncomfortable? Yes. Is it worth it? Absolutely. Because he said, oh, your prostate feels healthy. And I was like, oh. And then you get that relief from knowing. Just from knowing. Even if he says, oh, I'm feeling something alone, then if you catch it early, you have a better chance of treatment and survival versus you just not knowing. And then the other word that I want to ask you about, Doc, as we're getting close to our end, is metastasize. What does that mean?
Yeah. So the only word that I think of that's scarier than the word cancer, because believe me, we've had cancer affect several members of my family, and so I am while I wear the white coat and I'm the guy standing in the clinic, I've been on the receiving end, and I appreciate the fact that being on the receiving end is difficult. The only word worse than that to me was the word metastasis. Metastasis indicates is a term that we use in medicine to indicate that a cancer has left its original site and has gone to another part of the body. People will say, "Oh, there's a spot in my bone. Does that mean I have bone cancer?" The answer is no. It means a prostate cancer gained the ability to leave the prostate gland and get into that bone. Now, in many cases, we start to say things like, "Well, if the cancer's done that, we can't cure the cancer." But I put a big comma behind that, okay? Because it's treatable,
right?
And you have to realize this, because one thing that a good friend of mine, Dr. Zuri Morel, he's one of the surgeons I work with here, wonderful African American surgeon. He always tells folks, and I'm gonna borrow from him, don't die of fear, fear or shame. And if prostate cancer spread, what you got to do is got to be proactive about that. Now, we already had a question about the impact of diet and exercise. I tell those folks, listen, keeping your body in top form is a big step, because your body is trying to fight this thing. Your docs can give you medicines that can control this condition. Like I said, I've had men on medical therapy for their prostate cancer for more than a decade. Now, like any other medicine, even like high blood pressure medication, those of you guys that are out there that have had it, but even that comes with some side effects. I'd say every medicine you can take can have some side effects, but it's a trade-off, right? It's a trade-off between the risk of death and some side effects that, with a little bit of gumption, look, we're men. We're there to push through some difficulties, all right? And fortunately, we have those communities as our families, the people that love us, our kids, that help us to knuckle through those things. They want you to do that, and you can do it. I mean, it is absolutely positively doable. And the treatments that we have gotten so much better. I used to tell folks, 10, 15 years ago, I had like one or two things that I could do. I now have to make some informed decisions based on the molecular nature of a man's cancer, even for more advanced disease. And so being in a situation where you have access to good things, it becomes really important. Push your docs. Don't let them just say, well, we're just going to do this and don't worry about it. Get yourself informed. Keep yourself informed. Um, go out to communities. Ellis listed a couple very nice communities that have been out there to
Mhm.
promote awareness and information. The Prostate Cancer Foundation is one in particular
Yep.
for prostate cancer, where you can seek information. Even the government itself has cancer.gov, which is a nice website, and they, as is the American Cancer Society, and they have information that's particular to Black men. Uh,
Right.
get those data. I mean, they're clear as day that this is a substantial problem for the community. In fact, don't just get that information, disseminate it. I'm very fortunate to have encountered several groups over here. I'm actually speaking at the first American Methodist Episcopal Church, one of the kind of the oldest faith communities here in Los Angeles, about prostate cancer to a group of African American men. Um, and I've had invitations to come speak at several different groups. Find look, find your communities. Let them know that as they're doing health fairs, this is a topic that should be touched upon, so you can get that information out there. Because it really, we've got to kind of start a movement. One of my friends, Dr. Ken Orduna, who's a big civil rights activist and a good friend of Dr. Martin Luther King's, he always tells me, starting a movement takes only a few men to make that happen, to be a voice out there. And every time you amplify that, it grows and grows. And breaking the stigma, breaking those myths that Alice and I were just talking about is truly important. To getting to a state of being in a better position to handle these health issues proactively for all those people that are counting on you.
Absolutely. Well, I want to first off thank you, Dr. Posadas, for joining us today and kicking off our Men's Health Summit, our third annual Men's Health Summit, talking about something that's very specific to men, and that is our prostate health. A couple other things I want to leave you all with. Number one, now, as I listen, anybody that will listen to me and my friends know, I said on many of these panels, number one, that they asked me, I said, you are the driver of your health. So every time you put something in your mouth, you're making a health decision. So make sure that you are doing what you can do, control what you can control with regards to your health. And those four things that we say, remember this: EMTS, eat, what you're eating, what you're putting into your body; move, that's exercise, moving, that's going to help you. How you think, your stress levels, cortisol adds to that itis that we talked about earlier, that inflammation. So we've got to control our stress level, and then we have to sleep. We have to get the proper amount of sleep so our body has a chance to rest and repair through each and every night. And we have to sleep and get that REM sleep, not the nap sleep, that fully REM sleep, 2 cycles per night, which is about 6 or 7 hours of sleep, of REM sleep that you can get through. Get rid of that white light that's around. Turn off the TV, because that white light tricks your brain into thinking that it's supposed to be awake, and that's how you don't get good sleep. So remember that acronym: eat, move, think, sleep. And also remember, every time you put something in your mouth, you're making a health decision. So with that, I will say thank you all for joining us. We're not done. We've got another panel starting at the top of the hour. Please go watch that. This is our Men's Health Summit here on blackdoctor.org. Thank you so much for joining us, and we'll see y'all next time.